Right, Jaime, I appreciate it. Thank you very much. It's always a pleasure to be with you all. Just a quick thing before we kind of get rolling, I do need to read the disclaimer as you see it there. The material in this presentation has been prepared by Social Security's Public Affairs Office and is intended for educational purposes only. Participation in this presentation does not constitute an endorsement by Social Security Administration or its employees from the organization's information and products not provided by Social Security. All right, now we're ready to start rolling into it. Once again, thank you for connecting today to be with us and allowing me to present some of these important Social Security items when it comes to retirement or just Social Security in general. And that's what it is. I'm going to give you a brief overview, in the time that is permitted, but I can't make you experts, and that's not really my goal. My goal is to make sure you understand kind of the process, where we're going, and then where you need to connect to when you are looking for various information and all of that. So let's go ahead and jump in. And one of the first things that I share with individuals when it comes to Social Security and in my presentations is our website. So if you've been on our website before, you already are saying, hey, that doesn't look like the Social Security website. This is our new website that was redesigned and just went live the end of December going into the new year. So if you go back on, this is what it's going to look like, kind of bringing some of the information a little quicker and closer to you in this redesign. And so I hope that it is something that you find the information that you're looking for quicker, easier. I've gone through to take a look. And so it is, instead of kind of searching, it kind of brings it to the forefront as you go on. So please do utilize our website first. And the way that I say to use us as far as trying to get information or when you're doing anything when it comes to Social Security business, first check on our website. Our website has great information. There's a lot of online things that you can do as far as to take care of business. And then if not, one of the other things that you can do is to set up a My Social Security account. When you set up a My Social Security account, what it does is it's going to give you access to your own information, to your own account. Then when you go on to the My Social Security account, it's going to show you some of the different areas, some tabs. It'll have your estimated benefits there for you, as well as when you click on the statement will populate. And what you're going to see in that statement, as it's shown here, is the different programs are shaded. So it's easier for you to understand, okay, I'm looking at my earnings record, I'm looking at my retirement benefits or survivors, whatever it may be that you're trying to take a look at. And it gives you that understanding so you can read directly, know what section you're in as you're glancing through your statement. And one of the main things that I'm going to touch on is that earnings record, which is very important for you to go through and make sure that it's correct. If it's not correct, if there's a year that you earned a different amount, then that needs to be corrected with Social Security. Now, remember, we took all the paper, converted it into digital. So there could have been something that was lost, or in transition between your employers, there could be something that's transposed, and so it doesn't go into your record. And so maybe you have a 0 in a year, and you're saying, no, I've worked, completely through those years. That's what you need to make sure is corrected. And as we go into this, you'll see why that's important and why you should get it corrected as soon as possible rather than waiting till later. So with all that being said, let's take a look at how does an individual qualify for a Social Security benefit. The way that an individual qualifies is through earning 40 credits. There's a maximum of 4 credits that an individual can earn per year. And so this year in 2023, for every $1,640 that an individual is earning and paying into Social Security tax, then they get the 1 credit. So at the end of the year, as long as you had $6,560 or more earned into where you're paying into Social Security tax, then you would have got your maximum 4 credits. But since we're only looking to get 40 credits to be eligible, most people have done this early on because it's equivalent to about 10 years worth of work. So my estimation or my guess would be that most everybody on the call today has already hit 10 years worth of work. And so you're looking at going, okay, I already have my 40 credits, which means you're eligible. Another way that you can do that, or to know if that's the case, is on your statement or on the My Social Security account. If there is a dollar amount that we're telling you, this is your estimated benefit at full retirement age, and you see that dollar amount, that's one of the ways that you also can know that you've already acquired the 40 credits. And so we no longer have to take a look at or determine, or, it's no longer part of the discussion. You already qualify for retirement benefits. With that being said, that means that we can then progress on to probably what you're really taking a look at to say, okay, well, how much will I receive in benefits? And then we'll get into the question of, how can I take those? How do I use those? So let's go through and take a look at that. How Social Security determines your benefit is really based on what you pay into Social Security, as well as time, because we are looking at 35 highest earning years. So the first part of the process in determining your benefit amount is we're going to take all of your benefits, meaning, and let me go back here, all of those earnings records throughout whenever you have paid into work, whether it was a paper route or, back in the day, or you started after in high school, you started a part-time job somewhere and you were paying Social Security tax on, all of those are going to be in there. And so when we go back and take a look at that in the years that you paid in, what we're trying to do is we're going to index them for time, or really, we're just going to give them cost of living adjustments so that we're looking at apples to apples. We want your wages from 30, 40 years ago, work that you did, to be able to be at an equal value, so to speak, of current earnings. Once we have done that, then we select the highest 35, and it's not your past 35, it's not a sequential 35, it's the highest 35 years that you ever paid in. Because we do that, those wages that are adjusted for the changes in wage levels over time, those older work years that you paid into 30, 40 years ago, because of the multipliers, will have a higher value when we look at all of the years you've paid in. So it's very normal for us to see that in that part of that high 35 is early years. Then there might be a little bit of break where we jump to more current years, but we still have to, we're selecting the highest 35 years. In that highest 35, if you only worked 30 and then retired, then there's going to be 5 years of zero, because zero was the highest that you paid. And so it's really dependent on, how much you paid into time-wise, as I stated, the years, at least hitting that 35, and how much of that, the value of each of those years. Then what we're going to do is we're going to average those out into what we call an average index monthly earnings, or as we call it in short, an AMI. Once we have that value, that amount, that is the average over the highest 35 years into a monthly amount, an average monthly amount, then we can proceed into the actual calculation. What you see here is, let me walk you through, and this is just to give you an idea of how we're developing your benefit. If that average monthly earnings over the course of 35 highest years, not sequential, not your past, but highest 35 years, in this example, we're saying that it was $7,500. Of that $7,500, the first 1,115 in that first, what we call bend point, B-E-N-D, bend point, or you can call it a category or whatever you want to call it. We call it a bend point. You're going to get 90% back. So of that first 1,115, currently in 2023, this is how we're determining and calculating your benefits. You're going to get $921 out of that first section maximum, if you had at least $1,115 or more. In our example, there's more, so we go to the second bend point, and between 1,115 and 6,721, you're going to get 32%. In this example, it maxes out in that bend point, and so the amount that an individual can receive from that is 1,793. Then the last bend point, anything above that 6,721 of the average, the individual is getting 15%. In this example, that comes out to $1,016 or $116. The total of all of those put together, that bottom line number, the $2,830, is what we call a primary insured amount, or a PIA, primary insured amount. That's a term that if you're taking notes, I would jot down: PIA, primary insured amount. This is your full retirement age amount, the amount that you are eligible if you were to take your benefits at your full retirement age. That is everything's going to drive off of your PIA, whether you take it early, and we talk about how that affects, or whether you take it later and how that will benefit you. But the PIA is your full retirement age amount. And then again, everything drives off of that. So that's how we get to that. When you look at this, when we say that 90%, that's the anti-poverty portion. So we're bringing people right up to like the poverty level there on that. Then the second, the 32%, is because Social Security is never really intended to be your full or only source of retirement income. Social Security is supposed to be a portion, roughly a third, and then your savings and a pension system. But in most current history, work history, most people don't have a true pension system. What they have is only a savings program. So what that means is individuals have to increase the amount of savings in order to make up that difference, because Social Security is only going to provide about a third. It's usually between 30 to 40% of what an individual needs in retirement. So the other 60 to 70% will have to come from their savings, investments, however it is, but that's kind of what an individual should be looking for. So again, in this example, we come out with $2,830 as a primary insured amount, which is pretty regular, pretty close to where people are coming out with their PIAs right now as they start looking to receive benefits. I've seen a little bit higher, 3,000, 3,200, right in about there. Now, once we have that PIA, now we can go in and start talking about what you can do with it. What are your options? How should you approach this? And what does that mean for you? So the earliest point at which an individual can receive a benefit is 62. 62 years of age, and you have to be 62 through the entire month. So normally what that means is an individual that has their birth date on the 5th, on the 15th, on the 21st, or like me and mine is on the 14th. That means that the month I hit 62, I'm not 62 through the entire month. I would have to wait until the following month in order to be eligible at age 62. That would be the earliest point at 62, which me personally would be the month after I hit 62 because of my birthday in the middle of the month, because you have to be the entire month age 62. So that's where the starting point is. Now let me talk about what happens not only at the earliest point at which you can receive it, 62, but what impacts you here. And there's two things, so follow me and let's walk through both things. The first thing that's going to impact you is that if you take it prior to full retirement age, as early as 62, so anywhere between 62 and your full retirement age, we'll talk about your full retirement age in a second, you're going to have permanent reduction of your benefits. Your benefits will no longer go up. So let's say that you take it prior to full retirement age, you have to acknowledge and realize that you're taking it early, and therefore you'll have a permanent reduction of your benefits on your own record moving through the rest of your life. It never goes back up. So if you take it early, you have reduction, you're willing to. So what is that reduction? How does that impact you? If you look at the column all the way to the left, find your year of birth. Once you found your year of birth, go to the middle column, and that is your full retirement age, or as we call it, FRA, F-R-A, FRA. If you're born 1960 or later, your FRA is 67 until there's another change or law that creates Social Security law that changes that full retirement age. So we've gone from 65 to 66 in one of the times, and now we're in the middle of going from 66 to age 67. So find your year of birth, find your full retirement age, write that down, get a tattoo, paint it on your wall. However, it's going to help you to remember that, because it's very, very important that you understand your full retirement age. Again, everything is going to drive off of your full retirement age. So once you found your full retirement age, you wrote it down, you know that reduction is going to happen prior to that. The column on the far right, what you see is from 66 to 67, the reduction at age 62 moved from 25% to 30%, which makes sense because if 62 remains constant, the earliest age at which you can start, and the full retirement age went from 66 going to 67, what we're saying there is that the reduction amount is going to increase because we moved the full retirement age further back or up from 66 to 67. That's all that's telling you. So it goes from 25% to 30% if you take it at your earliest point, 62. So let me give you a better number, because most people aren't going to take it right at 62. Although some do, most aren't. The number is 0.5% for each month early that you take your benefit. If you take your benefit, let's say 30 months early, 30 months prior to your full retirement age, you take it 30 months early, you're going to have a reduction of 0.5% for each month early you take it. 30 months at 0.5%, 15%, roughly, if you want to estimate how much your reduction would be. And again, that's permanent reduction. If you take it prior to full retirement age, again, we're saying 30 months early at 0.5% per each month, 15% reduction. If you take it 20 months early, then 0.5% per each month, 10% reduction. And that would give you an estimate. So if you know your full retirement age, what we call your PIA, that full retirement age benefit amount off of your statement, and you say, well, I know I want to start about 40 months early. I don't want to wait until my full retirement age. I just want to start taking my money, take it 40 months early. Well, 40 months early would be equal to about 20% reduction. You know how much your earnings statement has listed as far as your estimated benefit. And so you can take 20% off of that and know, okay, this is how much I'm going to receive in Social Security. There are calculators that you can input all the information and give you a better number. But if you're just trying to ballpark it and you know your estimated full retirement age amount, then you can just attach that simple process of saying 0.5% for each month early if you take it early. Now, I stated that there are two things that are going to impact you, and we've only talked about one of those things. So let me go to the second. The second is this, that there is a earnings limit. There is an earnings limit. If you are under full retirement age, currently this year, and those amounts change every year, currently this year for 2023, you cannot earn above $21,240. Once you start earning your Social Security, you have to be below that annual limit. You have to be below the annual limit. If you are not going to keep your income, so let's say that you retire from the county of San Diego, but you're going to go work at Home Depot, or you're going to go work at some other place you've always wanted to work at, Costco, and pass out treats. I don't know, whatever it is you wanted to do. If you do that, you just need to keep your income below that amount so it doesn't affect your Social Security benefits that you start up. So you start them up early with a permanent reduction, and then you have to keep below these limits. Once you get to the month that you attain full retirement age, whenever you hit your full retirement age, whether that's 66 in a few months or 67, whenever you get to that month, from that point forward, your full retirement age forward, there is no income limit. So we're only talking up to that point. So the year of your full retirement age, we're looking at January up to the month prior of your full retirement age. Are you below the $56,520? We're not looking at the total year. We're looking at January to the month prior. So let's say that your full retirement age, your birthday comes 67 in July. We're only looking at 6 months, January through June. You make 75,000. So in those first 6 months, you're going to have roughly, 38, 40,000, whatever it may be. You'll be below that 56. So you could start in January. You're going to start with permanent reduction, but the reduction is only a few percent, right? It's 6 months, that'd be 3%. You're saying, I'd rather start my benefits and get as much as I can out of it before I even hit my full retirement age. And maybe you're going to continue working and you just want to start your Social Security benefits to be able to maybe pay off something or save it or invest it. It's yours. It's your money. You do with it whatever you'd like. But just know that there is a earnings limit if you start your benefit prior to full retirement age. The under full retirement age every year, these numbers go up. So you're going to have to check if that's the case. Starting as early as 62, permanent reduction, anywhere in between, because it's a month-to-month reduction factor. But the annual limit is set every year, what you have to keep below. And what is counted when we're looking at is only gross wages from your employment and or net earnings from self-employment. We don't count annuities, pensions, obviously capital gains, any of those things. We call them passive income. We're only looking at your earned income, work that you're doing, that you're getting money from, gross wages, W-2, or net earnings from self-employment. Hopefully that section is clear as far as starting early, your full retirement age, the permanent reduction, as well as the earnings limit and what counts. Once you have that, then we can look at the next option, which is full retirement age. If you went to all the way and you waited to start your benefits at full retirement age, you're going to be eligible to 100% of that benefit, or whatever your PIA is, your primary insured amount, that full retirement age amount. And from that point forward, no income limit. Remember, the month you hit your full retirement age, from that point forward, no income limit. So maybe someone is going to continue working to age 70 or 80. Maybe you're like me and you say, I love my job. Why would I ever stop working here? This is heaven on earth. I love what I'm doing, but I want to start my Social Security because I want to have extra money to do this, or want to, my grandchildren, or whatever it is for you. You could start at full retirement age, continue working, doesn't impact you negatively, your work and receiving benefits. You get 100%, no income limit from the month you attain full retirement age moving forward. If you wait to that point, you get 100% of your benefit. You start early, you have permanent reduction. It does not change at this point. You never make up that reduction. The other option that there is if you wait to take your benefits to the maximum point, age 70, there's no benefit past age 70 in the sense of waiting. It's not going to increase. But if you wait past your full retirement age up to age 70, you're going to get 8% for every year or every 12 months that you delay taking your Social Security benefit. That maximum delayed retirement credit, let's say from an individual for retirement age 67, waits to 70, 3 years, 3 times 8, 24%. a 24% increase. Now, this is a excellent investment on you if you want to wait and increase the value of your benefit. Now, again, when you look at all those options that you have, whether you're starting early at 62, but you understand you're going to take permanent reduction and you have an earnings limit, if that you're able to do that, great, and that's what you're willing to do. Or you wait till full retirement age, and then you get 100% of your benefit, no earnings limit from that point forward. Maybe you continue working, or you have even stopped working, or you haven't. Either way, it doesn't matter. But you're not going to take your benefits. You're going to let it create these delayed retirement credits of 8% per year. You're going to maximize and go to 70. Now you could go to 68, you could go to 67, you could go to 69, 68 and a half, wherever you want. And it's going to be month to month increase. So it's about 2/3% increase for every month that you delay taking your benefit. It's up to you. You have to make that decision. When people ask me, Jeffrey, what's the best time to take it? When should I take my benefit? There is no best time. The best time is when you have figured out, with all of your factors, priorities, what would be the best for you. Because maybe, and I have someone that I know, a relative, that they took early reduced retirement. They stopped working at the county. Matter of fact, this individual worked at the county, is taking their benefits through the county as far as pension. They are starting at 62 on Social Security, and that was sufficient for their needs to be met. Where I've had other individuals say, I can't start early, I have to work through, and then at full retirement age, I should be enough, and that's where they start. And others that say, you know what, I have longevity in my family, I want to increase to the maximum benefit amount, and so they wait for DRCs up to age 70. The choice is yours. You have to figure out what are your priorities in retirement and how that either is going to be impacted or affected one way, whether good or bad, on Social Security, to where, when do you want to take it? And all of those factors and priorities are going to be individual. There's no way to say this is always the best. Everyone should take an early reduce. No, because it depends on the individual. You may have different priorities and plans in your retirement as you move forward than the person sitting next to you, and that's why they're going to wait and take it later, and why you start early. So it really is up to you to determine what is it that you're trying to accomplish with Social Security. And then you look at, okay, I can take it reduced, I'm going to stop working, I need to increase, and that allows me to retire completely, or I'm going to wait until I hit Medicare age, and we'll talk about that in a little bit. That way I have Medicare, as well as on top of that, I'm able to supplement through the Social Security income, whatever it is that you want to do. Spousal benefits. This is a question that usually comes up. Most people don't even realize how spouse benefits work with Social Security, or that they're even eligible, or potentially, I'm going to use that word, potentially eligible. So let's walk through that. Understanding spouse benefits. Here we go. There's two types of spouse benefits. One is, well, the spouse or the number holder, what I'm going to call the number holder, while the number holder is still alive. That's a life claim. Auxiliary spouse benefits. That individual is potentially eligible to a maximum of 50% at full retirement age of their spouse's PIA. Let me state that again. 50% of the PIA of their spouse, of that number holder, when the individual reaches full retirement age, they're eligible to 50% of the PIA of their spouse's, on their spouse's record. They could start as early as 62 with reduction, the same type of reduction we looked at, as well as the same income limits. All of that is still in play, the same thing. Now, here's the kicker on this, and you need to listen to this real close when it comes to spouse benefits. An individual, if they take a benefit under a life claim, has to take their benefit, whatever they're eligible on their own record first before we even consider a life claim benefit for a spouse. Meaning, if your benefit is, you're eligible to $2,000 on your benefit, your spouse is eligible to $3,000, so you're potentially eligible to $1,500 on your spouse benefit. And you say, well, instead of taking mine, I'll let mine grow in a higher value. I'll take the $1,500 on my spouse record and then jump over to mine later. No, can't do that. You have to take your own benefit first before we even consider a spouse. And because your $2,000 that you're eligible at your full retirement age is greater than the $1,500 that you're eligible on a spouse record, means you're not eligible, or you're technically eligible. We will give you $0 if you start that spouse benefit. That's all that means. Maybe you're not going to be eligible in the life claim, but perhaps in that same example I gave you, in the death claim, you're potentially eligible. How? Because in the death claim, which would be survivor's benefits, now goes from 50% to 100%, whatever the greatest value on that claim is. So instead of 1,500 that you're eligible, now you're eligible to that full 3,000. So you leave your 2,000, you can't receive both. You leave your 2,000 behind. You take the 3,000 on the death record or the survivor claim. But here's the thing that I need you to make sure that you understand, that when a spouse predeceases the other, you're going to have a decrease in whatever the lowest value of benefits between each of your records. So in that example where I had 3,000 and 2,000, together you're getting $5,000 from Social Security. But the moment one predeceases the other, if it's the higher that predeceased, then the lower benefit comes up to 3,000, but no longer receiving the 2,000. So what used to be 5,000 in the household now goes down to 3,000. And you have to plan accordingly and understand that if you budgeted completely off of the total amount of Social Security and anything else that you had, and that's you're living at your maximum budget and amount of income, you have no cushion. And so in the event of death, because of Social Security, not even counting whatever else might be impacted, just Social Security, you're going to lose one of those benefits off of whichever is the lower. And so plan for that accordingly, knowing that it's going to change in the future. Divorced spouse benefits do exist, meaning if the marriage lasted over 10 years and the individual has not remarried and qualifies in all the other ways, they could receive benefits on that record. The only difference here is that a divorced spouse does not have to wait until the number holder starts receiving their benefits to be eligible on that record, even if the number holder has not predeceased the other. In a current marriage, to get the life claim benefit, the number holder has to start receiving their benefit to make their spouse eligible. But in a divorced spouse benefit situation, they do not have to wait. The number holder simply has to have reached age 62. Whether they're receiving their benefit or not, that doesn't impact. They just have to be age 62 or older for the divorced spouse to be able to collect on that record. Everything else is the same. Income limits, the age limits, the reduction, the permanent reduction, everything off of that record, just like we had gone over before. There are many other types of benefits, the disability and children's benefits, all those type of things. But I just need to get through retirement. as well as a spouse benefit, because that's usually what will impact most people at retirement. Now I want to switch gears and go into Medicare. Medicare can become extremely confusing because most people understand that in order to become eligible or to apply for Medicare, you go through Social Security. But Social Security and Medicare are two separate agencies. We're not the same. So this causes already initial confusion. So what I'm saying is that Medicare has its own rules, and we're just initially enrolling people in, and off of the Social Security benefit or other means, the individual has to pay for the Medicare premium, whatever that amount is, to keep their Medicare running. That's going to have to go through Social Security. Everything else is done through Medicare. I would encourage you greatly to go onto the Medicare website. It also is a good website, it has good information. I would consider on the site menu, which is really on the bottom part of their main menu, what Medicare covers. That's usually what I look at to have a better understanding of how Medicare works and what it's covering between the different parts A, B, C, and D. And with that being said, let me share a little bit. Original Medicare A and B, you can add in D a prescription or a supplemental, what we call a Medigap. All of those, and it may be even through a plan through an employer. That's kind of done through the original Medicare's route. The other route would be using a Medicare Advantage program. You get A and B, and then whatever medical provider has been approved through Medicare, you'll have options. In San Diego, I believe that there's like about 20 different options, I believe. I know in Orange County, which I cover as well, I think it's about 30. So you'll have different options that you can utilize your Medicare with to, and what you're doing is you're giving it your Medicare under them, and you become eligible under their medical providing or provider system. So Advantage programs, the nice thing about that, the Advantage programs, is that there usually is no additional premium. You're just using co-pays. You still have the Medicare premium. When we talk about the Medicare premium, I'll come back to this in a second. Let me go over there. I just want to show you. For 2023, the standard Medicare premium for Part B. Part A, you pay into Medicare, you get Part A at no cost. Part B will always have a premium, and this year it's $164.90. Now I'll come back to that. Let me go where I was at. That's kind of how those Medicare options that you have. Once you make a selection, or if you need help making a selection, there is a group called HICAP, Health Insurance Counseling and Advocacy Program. And as you see, every county in the state of California, because this is how we do it here, is broken up. And so Medicare is by county. So if you move from San Diego to San Bernardino, then you're going to have a different plan that you're going to have to choose from, or you move to one of the other counties, wherever, then you're going to have to select a new Medicare option if you do that, because it's ran by county. So here in the county of San Diego, the HICAP group, this Health Insurance Counseling and Advocacy Program, which is at no cost to you, is paid by grants through Medicare to do advocacy, and that's all it is, solely advocacy. Here in San Diego is done through Elder Law Advocacy, and here is their contact information. You can call them. I would not walk in. I believe that they don't have walk-ins available, so you're gonna have to call, make an appointment, or go to their website and do so. But they are able to help you make the selections on what do you want to do with your Medicare, what route is going to be best, and you can compare those. They can help you with that. Enrollment periods are very important. There are 3 different distinct enrollment periods: initial, special, and general. Initial is the moment you become eligible, which is at age 65. You're going to have 3 months before and 3 months after, total of that 7-month block that you can enroll into Medicare. If you enroll in the first 3 months prior to age 65, then the month you hit age 65, your coverage will be effective. If you wait until the month you hit 65 or any of the subsequent 3 months, then your effective date would be delayed by 1 month. So if you came in the month you hit 65, your Medicare would not be effective until the first day or the entire month of the following. So again, let's say July. July is when I turn 65. I enroll into Medicare in July. I didn't do it before. I didn't understand the process. Well, I'm going to be effective in August. So just keep that in mind. If you need it to be effective the month you hit age 65, you're going to have to enroll 1 to 3 months prior to the month you hit age 65. So that is initial enrollment period. But if you are receiving benefits through a current employer or through a spouse's current employer, then you'll have special enrollment. Special enrollment says from 65 on, you had coverage through a current employer through their medical coverage, a large group health plan, then you can delay taking it. And when you terminate your employment or your spouse terminates their employment, at that point, you're going to have 8 months to enroll into Medicare without any penalties. And the month that you enroll, you would be effective the following month within that 8 months from termination of employment. Or at any time, if for some reason you don't want to use the coverage through your employer anymore, and you find it more beneficial to go through Medicare, then you can drop your work coverage and go through Medicare. And you can do that at any time past age 65 under special enrollment. Month you enroll, you become effective the following month. General enrollment says you made some mistakes here. You didn't do it initially at the age 65, or you didn't have work that you had coverage, medical coverage through an employer, a current employer or spouse's current employer, then you can only do general enrollment. And that's January 1st through March 31st. Your effective date is the month following your enrollment into it. But what happens with general enrollment is this: for every year, 12 months past age 65, that you did not have coverage through a current employer, you will have a 10% increase on top of the Medicare premium. So when we talk about that 164, let's say that you waited 2 years, you felt healthy, you didn't need Medicare, you didn't want to pay for something you don't need. That's your choice. It's voluntary. We can't force you to take Medicare. But the moment you're ready to come back in, you say, you know what, I need it now. I'm starting to have some issues, need to see doctors. Now you're going to have to take Part B. And those 2 years past 65 where you did not have coverage through a current employer, for every 12 months or every year, you're going to have a 10% increase. So for 2 years, you would have a 20% increase. So in this case, an additional $32 on top of that premium. And that is for the rest of your life. It never comes off. Let's say that you really felt healthy and you waited 5 years. You say, well, at age 70, I'll take it. You didn't have coverage through a current employer, 50% on top of that. So keep in mind your enrollment periods. It's very important that you understand and that you enroll accordingly to whatever your needs and whatever you're doing. And keep in mind, if you use the option of general enrollment, then you're going to have potentially this increase. If you don't have that coverage and use the general enrollment, it will increase, and that is for the rest of your life. I talked about the standard premium, $164.90. There's also this thing called an income-related monthly adjustment amount. Dependent on whatever your modified adjusted gross income is on your IRS filings, and Medicare uses 2 years previous. So for 2023, we look at 2021. And it's always a rolling window. 2024, we'll look at 2022 and ongoing, always 2 years previous. When you look at this chart, what we're saying is that if you fall, your modified adjusted gross income from 2 years previous falls in one of these categories that is above the limit of the 194,000 for a couple or 97 for an individual, then you're going to have the standard premium plus an additional amount. And you can see those amounts for this year, depending on what your modified adjusted gross income is. Now, if you retired in 2023, in 2021, you and your spouse were both working, so it's why your income was above. What you can do, if you get that IRMA notice, the income related monthly adjustment amount, and they get a notice and it says you're going to have to pay this additional amount, you may look and say, well, wait a second, I just retired, so my income, my estimated income for this year is much lower than what I had over there. I was making 300,000 together with my spouse, but now we're going to be down to 150,000 because we're not working. Well, you would file a SSA 44, a life-changing event form. You send that in, each of you, if you both have Medicare, you and your spouse, it's per person. And you're going to request a waiver to say, my income for this year, I estimate to be this. I don't want you to use 2 years ago because I have this life-changing event. I am now retired. Gives you access to it. We can review it and determine whether we reduce that additional amount to wherever the category that you're telling us you estimated your income would be for that current year. So some people will have to do this for 2 years until after their retirement kind of catches up. When you're ready to retire, then you want to look at applying. Online is the best and easiest way. Takes less than 15 minutes. So I jokingly say, better than Geico filing for Social Security. If you really don't want to do online, then you can call the 1-800 number, set up an appointment, and you can do it over the phone or set up an appointment to come into the office. Why you want to come to the office, I have no idea. Sometimes parking is a nightmare. It can be cost and other things when you could easily do it online or do it over the phone if you just don't want to do it online or don't have the capability. That's fine. But I would still suggest getting an appointment and letting us take it over the phone rather than coming into the office. Reserve coming into the office only if necessary. That would be what I would suggest and kind of direct you in. Again, you can walk into the office, but depending on what's going on in the office, they may not be able to see you or take your claim that day. You may have to still set up an appointment. So why chance that? Just go online and get it done or call the 1-800 number, set up an appointment. Again, I would suggest just do it over the phone. There's still that representative will still be able to help you answer any of your questions, make sure that you're comfortable knowing what you're doing. So you're ready to retire, you're ready to jump in and start your Social Security benefits. And again, that would be my suggestion. As we start to wrap up today, again, I would encourage you to go online. If not, then you can use our 1-800 number to call and set up an appointment. Keep in mind right now, again, as I stated so many times, appointments are very helpful. Masks are required in every Social Security office, regardless of whatever your vaccination status or whatever the county says, whether you have to or not. In Social Security offices, they are required. There is some visitor capacity limitations, so take that into consideration when you are going to come into the office, that there potentially you might have to stand for a great deal of time. You might have to stand even outside, depending on how our offices are set up. So I would suggest, again, online or filing and going through the phone, setting up an appointment. Can only go into the office if you really, really need to. I appreciate your time. And so what I want to do is the rest of our time together, and I believe that Jaime is going to come back on and walk us through the Q&A. But I appreciate your taking time to invest into your own retirement. Wish you all the best in your retirement. Jaime?
Thank you, Jeffrey. So before we get to the questions, I just wanted to make a couple of points here. For the people requesting hard copies of the presentation, requesting the presentation be emailed. There was somebody who wasn't able to keep up and take notes. Just remember, the two ways you're going to be able to access this. The PowerPoint as well as a recording of this presentation are going to be posted on Insight within a few weeks. And then additionally, on the Insight benefits page, under important topics on the left-hand side, you'll be able to find the PowerPoints also. So keep an eye out. You can rewatch this webinar. You can print the PowerPoints, but those are the ways that you would access the information. Additionally, for those of you that need more Medicare information, we're going to have a webinar just like this, another Lunch and Learn, next Wednesday, January 25th at noon. Same format as this one, but it's going to be all about Medicare. And we're going to have a presenter who's going to do a Q&A for your Medicare questions. So next Wednesday, if you're interested, that will be there for you. And then, yeah. So that's it. That gives us about 7 minutes for questions. There were some very good ones that came in. We did get a lot. I don't think we're going to make it through all of them, but we'll get through as many as we can. So number one, Jeffrey, I have a question about WEP and GPO. Can Social Security be reduced by my pension through SD Sarah? And I think breaking down those acronyms, WEP and GPO would be a good start.
All right, so WEP and GPO, WEP is windfall elimination provision, and GPO is government pension offset. And this is for individuals that have paid into a government pension and not into Social Security. So if you're developing a pension that you're not paying into Social Security, this is where that would cover you. Now, right now at the county, from what I understand, it may depend on that individual's position, right? But for the most part, county employees do pay into Social Security, so this penalty does not affect them. And so the windfall elimination provision is a penalty that affects someone's own Social Security. It doesn't affect the pension, it affects the Social Security benefit. And that, you know, Jaime, I'm going to say is pretty, we got to go pretty in depth. So I'm only going to give just a real quick thing. And that what it means is that on that calculation, the first bend point, instead of 90%, the individual gets 40%. So it's about a $500 difference right now for an individual that has a windfall elimination provision on their own record. They'd be reduced about $500 to whatever they're eligible on Social Security. But we also have a WEP guarantee, which means we won't take more than 50% of whatever your government pension is. Now, government pension offset is on a spouse record. So let's say like a survivor claim or a auxiliary spouse benefit. It's going to be 2/3 of your pension is counted directly or is offset directly. So very different. The WEP is on your own record. GPO is on a spouse record. And that's about as in-depth as I want to get at this point. If the individuals need more help, we'll provide a path for those that stay with us, and they can see how they can contact me if they really do need some additional help.
Appreciate it, Jeffrey. Yeah, just the broad general information. We don't need to get into the weeds here. The next question was asked by a couple of people. So is rental income considered earned income, rental properties?
No, it's not. That's considered passive. So when Social Security looks at income, the only thing we're looking at is W-2 and net earnings from self-employment. And so rental is a whole different subject under that. So that does not count.
Thank you. Next question is more of a technical website question. In your Social Security statement, it says for each month you wait to start your benefits, your monthly benefit will be higher for the rest of your life. However, the estimator shows that your monthly benefit doesn't change until a full year after your full retirement age. Even though the estimator doesn't show it, it goes up by 2 to 3% per month, correct?
Well, that seems pretty involved there. If you wait, and I'm not sure how they're looking at that and how, what they're exactly asking and what they looked at. But I'm going to kind of guess and try to give a certain answer to it. So when you go up and as you're stating, the benefits that are increased when you take your benefits after, right? They're saying after full retirement age,
Mhm.
the benefits that you have, the delayed retirement credit will not show immediately. It kicks in the following year for middle of the year. We can only go full calendar on the delayed retirement credit. When it's prior, when it's reduction, the reduction is taken from the moment they ask to start receiving benefits. But let's say that there's income, and that's the only reason it's going to change is if there's income that is above the limit, and therefore we have to reduce certain months, those are going to get kicked back, but it's after full retirement age. So I'm not sure if there's a little bit of confusion on the way they're asking it, but that's kind of how it works.
All right, thanks for the clarification. Next question. If you reach full retirement age and continue to work, when is your monthly payment adjusted to reflect your new higher quarters? Is that an annual process, or how does that work exactly?
Yeah. So anything that you earn, and I'll take this in kind of general because I'm going to assume this is what they're trying to ask. If you continue working past your full retirement age, whether you take your benefit or not, we recalculate your benefits every year. So after the IRS sends us the amounts of what you had earned, it gets to us about mid-year. And so by fall, we have your new amounts. Now, if you started taking benefits and continued working, again, that same scenario, we recalculate and determine, does your PIA go up? If your PIA goes up, then we increase your benefits. If it doesn't, then you stay at the same amount. So it's hopefully I'm kind of answering that question. I'm not 100% sure if I am or not. The questions seem to be a little diluted in the way that they're asked.
Yeah, it's challenging because they're coming in throughout the presentation. But we're doing our best. Looks like we're at 1 o'clock. So one final question. Again, you can just answer this broadly. What if you retire because of a disability? Do you still have to wait for full retirement age?
No, so disability is a whole separate benefit. Disability pays at full retirement age amount. So if you were 50, we'd look at your record and say, as of right now, this is what your full retirement age would be based on what you had worked and paid into the system at that point. And we would pay you as if you had full retirement age. And so from the point you start your disability to that point, that's what you're eligible to. And if for some reason you get better and you're able to go back to work, you could go back to work, and you haven't taken your retirement yet. So when in the later, and whenever you get to that point, you could start your retirement. You would still have reduction if you take it early, or you can wait to your full retirement. And if you continue to work, you pay in, and it would increase your PIA. So hopefully that kind of helps give a little bit of light on disability.
Yeah, exactly. I think just a little bit of information is really good. So I think that's going to do it for the questions. I do apologize we weren't able to get to a lot of these, but I do encourage everybody to take advantage of the resources that Jeffrey provided. Again, this is going to be posted on Insight with the recording of the webinar. PowerPoints are going to be in that article. PowerPoints are going to be on the Benefits Insight page on the left-hand side under popular topics. With that, thanks to everybody for attending. I'm going to hand it off to Jeffrey to give us the sign off here and put in his last few words.
Yeah, thank you, everybody. I do appreciate, again, go to our website, check to see the information there. If you're really stuck, then you can reach out, to an office and try to get that information. And if you're really having trouble, I'm going to say this, reach out to me. I am your public affairs specialist. I have no problem with you reaching out. The only thing I ask is that you already check the website you looked, you're having problems getting the answers, and this would be for advocacy, learning about Social Security, with some of that web, GPO, or something kind of a little more complex, then shoot me an email, give me a little bit of time, but I'll try to answer that and send you back an answer.
Thank you, Jeffrey. That's going to do it, everybody. Thank you for attending. Have a good afternoon.